So now we're going to talk about congenital pathology of the kidneys. And the first one we're going to talk about is something called Potter sequence. And Potter sequence arises due to decreased urine output. It's going to be a constellation of symptoms that arise due to decreased urine output. Now, there are many different causes for the baby having decreased urine output. And first of all, I want to add that this development occurs even when the baby is in the womb. Actually, it does occur when the baby is in the womb. That's when the problem occurs. And so, you can have decreased urine output due to various factors. The most common and classic one is bilateral renal agenesis. That means that both of the kidneys of the baby did not form. So if you don't have any kidneys, you're not going to have urine output. The other ones you can have include some things like posterior urethral valves or autosomal recessive polycystic kidney disease. Both of these urine can't come out. We're going to talk more about those later. So if urine's not going to come out, what's going to happen? Especially in the fetus, while the baby's in the womb of the mother, what's going to happen? Specifically, what's going to happen to the amniotic fluid in there? The answer is there is going to be too little amniotic fluid, and that's the word called oligohydramnios. And the reason for this is that most of the amniotic fluid derives from fetal urine, okay? So the baby is normally just swimming in its urine and it acts as a cushion for it. But if you have this decreased urine output, as we see here, then we have a problem. We have oligohydramnios, you lose that fluid cushion, and now you're going to get compression of the fetus. Now there's going to be a varieties of symptoms that's going to be associated with this Potter sequence. Okay, a variety of symptoms. First one is pulmonary hypoplasia. The reason why is because there's not enough amniotic fluid. Baby normally aspirates that amniotic fluid into the lungs, and it helps distend the alveoli, helps stretch them out. Not enough amniotic fluid, less stretching of the alveoli, now you get pulmonary hypoplasia. Flat facies is basically a compression of the face. There's not enough amniotic fluid here, so this kid's face is smack up against the womb and it gets flattened. Okay. Same for the limb deformities, as you can see here. There's not much cushioning at all. His foot is just like pressed against the womb and it's going to become deformed. So all this arises from decreased urine output and oligohydramnios. Make sure to remember pulmonary hypoplasia, flat facies, limb deformities. That's going to be in Potter sequence. Next is horseshoe kidney. Okay, and in this disease, kidneys are fused together at the lower pole. Okay, it's a problem where the kidneys are fused together, and because they're fused, they have difficulties ascending up. They normally go up this way to where they are normally in the back, so they're normally up here somewhere. But because they're fused together, they're going to get trapped by the IMA as they ascend, and thus they're going to remain low in the abdomen. They're going to be lower in the abdomen than where they normally are. The other thing to note here is that in this disease, the kidneys function totally normally, okay? Function of the kidney is totally non-impacted. Alright, next is renal agenesis. See, tough from the name, it's failure of kidney formation. And this results from failure of the ureteric bud, which we talked about. The ureteric bud was part of the metanephros, okay? A failure of the ureteric bud to form. And normally remember what we said the ureteric bud does? It reduces formation and the differentiation of the metanephric mesenchyme. So there's not even any formation of the metanephric mesenchyme, so that's not even there. So you're missing this too, so you have no kidney, okay? You're completely missing your kidney. Now this can happen on one side, as you can see here, or it can happen on both sides. And then you have either unilateral or bilateral renal agenesis. Now, if you're only missing one kidney and you still have a kidney here, then urine's still gonna be able to filter out your blood, and it's still gonna produce urine. But now all the blood is going to this kidney, so you're gonna get hyperfiltration. Now, this is something that takes place over a long time. But this hyperfiltration can eventually cause hypertrophy because it's working extra hard, and then eventually long-term injury. But again, it's a very, very long-term process. Finally, if you're missing both kidneys, then you're in trouble, and you have Potter sequence because you're not producing any urine. And eventually, if you don't figure out a way to filter the blood and things, you're going to be in trouble if you have bilateral renal agenesis. Okay, so now we have multicystic dysplastic kidney. In this case, the ureteric bud does form. So renal agenesis, you don't even have formation of the ureteric bud. In this case, it does form, but the problem here is the failure of inducing differentiation of the metanephric mesenchyme. It does not induce differentiation of the metanephric mesenchyme, so now you're going to have a bunch of non-functional kidney tissue. It's going to be made of a bunch of cyst and connective tissue. Okay, that's what we see here. We have a multicystic dysplastic kidney arising from failure of the ureteric bud to do work on the metanephric mesenchyme. Again, this is usually unilateral, but if it is bilateral, these kidneys don't work at all, so you're going to get the Potter sequence. So now, next problem here is the duplex collecting system. This results from a duplication of the ureteric bud. And we talked about how the ureteric bud is just going to become your collecting system and then your ureter. So if you have two of them, now you get two ureters, two collecting systems. And what can happen here is that you can be at risk for vesico-ureteral reflux. So what that means is vesico refers to the bladder, and the ureteral is the ureter. So it's reflux of urine from the bladder up into here. Okay, and that's just because these ureters aren't placed in the optimal position, and usually they're placed in a very optimal position to prevent this urine from leaking backwards. But in this case, there's a problem with the development, and so urine can leak backwards up into the kidney, and that can cause some problems. Or the other thing that can happen is you can actually have a ureteral obstruction. Again, that's from improper positioning of this ureter, and it can lead to obstruction. And so urine can't even flow down in this case. Okay, next is ureteral pelvic junction obstruction. So let's break that down. Ureteral, again, refers to the ureter. Pelvic junction, that's the pelvis of the kidney, which is around here. And that's where the obstruction is, as you can see. So it's a blockage of urine from the pelvis of the kidney to the ureter. Urine cannot flow, okay? Urine can't flow this way. There's many different causes of this. For example, you don't need to memorize this, but you can have things like a stricture, you can have tumors, you can have, just radiation just causing fibrosis. That can all cause obstruction of this junction right here. And then you're going to get something called hydronephrosis. We're going to learn more about this later, but this is a term for swelling of the kidney. So hydro is water, so it's just a bunch of water, or in our case, urine in the kidney, in the nephros. And as you can see here, it's very swelled up. Okay, next we have posterior urethral valves. This is our last congenital pathology. So this is a problem where you have remnant membranous folds in the lumen of the posterior urethra. So you see it all in the name again. Posterior urethral valve. So posterior urethra just refers to the back part of the urethra near the bladder, as you can see here. So this is the bladder. This is the neck of the bladder. Urine's flowing out. But now we have these membranous folds that usually should disappear, but they haven't. And they're blocking the urethra. There's obstruction in the posterior urethra, and so urine can't get out. So that means urine's going to stay in here, and it's going to cause the bladder to balloon. So you're going to get a thickened bladder wall. And if you have increased pressure here, there's increased pressure, then it's going to cause backup of urine in the ureters as well, and that's going to cause hydronephrosis, which we just talked about. What was hydronephrosis again? Remember, that was swelling of the kidney, and if it gets severe, you can also get swelling of the ureters. Okay, so that's it for our kidney congenital pathologies.